than that. The cooler temperatures are nice, but they also signal the beginning of flu season. Now the Centers for Disease Control is launching a new awareness campaign, and part of it is the CDC is recommending stepping up vaccinations for younger children. So here to talk about the flu season, who needs to get the shots, who doesn't, we'll answer Mark's questions as well. Dr. Elizabeth Salata, an internal medicine specialist, thanks so much for being here again, as always. And you have 3 little ones, and you already have given them the flu shots.
I do. They're 4, 7, and 10, and they've gotten their shots already.
All right, but you know, also the flu season, when does it sort of officially start? October 1st?
Well, it starts when you see the flu around, and we've had 1 case in San Diego already. Okay. So it's here. Typically it starts in the fall, but it tends to go all the way through the spring. So,
but really it's not a good idea to wait until you see cases of the flu before you say, oh, I need to go get my shot.
Yeah, the reason is it takes about 2 weeks to develop immunity after you get your vaccine, and then for young children who have never been vaccinated, it's recommended that they get 2 vaccines, and you have to wait about a month apart between vaccines. So in order to get that maximum immunity, you need to start early.
And how young should kids get the flu vaccine then?
Well, it generally depends on their health, but typically healthy kids should start at about 6 months. And then now they're recommending that you go through age 18, which they didn't always recommend, you know, children between, say, 5 and 18 getting the vaccine. But now they're recommending basically all children get the vaccine.
Okay, yeah, here it says children between 5 and 18. But again, you can get it a lot younger than that. Just talk to your doctor about it.
And younger kids, especially high-risk kids, like kids with asthma and things like that, should be getting vaccinated. Generally, all healthy adults should be getting vaccinated. And it's typically people that spread the flu around, so that's why we're recommending the children. And then high risk, meaning like you work in the medical industry, you work in healthcare facilities, you work in daycare facilities, you work in public places, dormitories, healthcare workers. Pregnant women are especially at risk because of their status. They're a little immune compromised, and so they want to be getting the vaccines.
Now, let's talk about the difference between the flu shot and the flu mist, you know, the nasal vaccine.
The shot is inactivated, and the nasal vaccine is live. So that's the big difference.
What does that mean for people who are interested in one or the other?
Well, certain populations shouldn't, like very immune-suppressed patients should not be getting the live vaccine, and people that are immune-compromised in certain circumstances should not be getting the live vaccine. So really you should talk to your doctor about which is right for you. But there are 2 options, and then the Pediatrics Journal just recently suggested that probably the nasal vaccine is slightly more effective in kids.
Okay, so kids can get that.
Yes.
And they probably prefer it because they don't want the shot.
Typically they don't like the shots. So really, and like I said, certain children shouldn't be getting the nasal vaccine because especially if you're prone to like things like asthma, where you might wheeze, that the nasal vaccine can make you wheeze a little bit more than usual. So you want to really talk to your doctor about what's right for you.
And these are some of the high-risk conditions, or
right. Again,
people that have it.
And high-risk meaning the people that definitely should be getting the vaccine, which is people with underlying lung conditions or heart conditions, diabetics, children, as we mentioned, patients that are immune suppressed, and especially the elderly, because those are the most likely to get superimposed things like pneumonia and bacterial infections. Patients who live in close quarters, as we mentioned, such as dorms, nursing homes, you know, the college students that are living together and sharing close quarters, they're going to really spread that influenza along. And the issue really is that you can not realize you're contagious and spread it, and then 5 days later you're going to get sick. So,
yeah, because, okay, so there's an incubation period that lasts a little while.
And you may not be symptomatic while you're passing it along.
Oh, great.
So that's the problem.
So preventative, you know, wash your hands and do all of those easy...
Absolutely, that definitely helps. The issue, too, is, you know, you get infected with the virus and then you're more prone to, like, staphylococcal infections. That's really what's causing death a lot of times.
We had a story about that last week, too, about how kids who were having incidents of death, even, also have staph infections.
And that's the problem, because you get infected with the virus and then you get immune suppressed. And then you're more susceptible to bacterial infections, and bacterial infections that are out there are higher risk because those are resistant to the antibiotics, like the staphylococcal infections especially.
Okay, 2 more questions I want to get in really quickly are the side effects. People are worried, if I get a flu shot, am I going to feel a little bit sick over a few days afterwards? Does that happen?
Well, it depends. Some people swear their flu shots have made them sick as dogs. But typically what happens is people can get a little bit of a sore arm, sometimes a low-grade fever, sometimes some body aches, things like that. Again, you're going to be a little more prone with the live virus, but the inactivated virus can cause you a little bit of achiness as well.
And then also, last year the vaccine was not that effective in many cases. So has it changed this year?
Interestingly, this year they changed all 3 strains, which they don't typically do. But every year they try to do their best to target the vaccine. Some years they'll change 1 strain, some years they'll change 2. This year they changed all 3, hoping to get a better target for this season.
Okay, all right. Well, let's hope we don't get those sick calls then
That's
coming
right.
in. All right, Dr. Solana, thanks so much.
Absolutely.
Good to see you.
Take care.
All right, have a great day.
Thanks.
For more information, go to san diego6.com and click on Hot Topics.